Like all border states and provinces, Manitoba and North Dakota have really strong ties. After all, 90% of Canadians live within a short distance of the border with the United States, and now that we're in a pandemic, that border should not be used to keep the cure for COVID out, but it is. About a month ago, North Dakota Governor Doug Burgum and I reached an agreement to have Manitoba truckers vaccinated in North Dakota. It was a good first step. We've now got over 1,000 truckers that have been vaccinated as a result. More to come. We led the way. Other provinces and states have followed suit as well. That's good news. Saskatchewan's working with North Dakota. Alberta's working with Montana, Ontario with Michigan, so on and so forth. But the best solution is not to have Canadians going across the border in small numbers for vaccines. The best solution is to have vaccines coming up from the United States in large numbers. The United States has millions of vaccines in freezers. They need to be in arms here in Canada. This is a call to arms. Manitoba is currently the North American hotspot. Our vaccine team has assured me that they could vaccinate an additional 100,000 Manitobans in the next 10 days if we had the vaccines here. We have trucks with freezers ready to go to points in the United States within a few hours to pick up those vaccines. We could have them back by tonight. We could be vaccinating additional Manitobans tomorrow. The best way to beat back the third wave is vaccines. Vaccines are the key. Thus far, President Biden has said no. I say, let's go, Joe. The right answer is yes. We need your help. And we need it now. Every premier, every governor along that border wants to restore our social and economic partnership, and they want to do it pronto. To do that, we have to defeat COVID. And we have to do it together. Canada and the United States have the world's longest and strongest partnership, not just economically, but socially as well. And that relationship has served to strengthen not only us, but the world. And that relationship matters. It matters to us in Manitoba. And we've shown we're ready to do that by building a strong working relationship with North Dakota. Last week, the New England governors and the Atlantic Canadian premiers and the Quebec premier signed a unanimous agreement that they want to solve this problem the way I've just described, by moving vaccines that are not needed right now in the New England states up to Canada and getting those vaccines in arms. This is a call to arms. We need this resolved. We need to ensure that our border is used to keep COVID out, but that it's never used to keep a vaccine out. Thank you. I'll be happy to take your questions.
Thank you, Mr. Premier. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this morning from the Winnipeg Free Press, Maggie.
Hi, Maggie.
Morning, Premier. Maggie here from the Winnipeg Free Press. If getting doses into as many arms as fast as possible is critical, why are more vaccine appointments not taking place on Sundays and on holidays such as this long weekend?
The more vaccines we have, the better. Our vaccine team has done a great job of rolling out vaccines increasingly rapidly. But we just heard, Maggie, yesterday that our supply will be reduced because of shipping difficulties and orders not being met by 20% in June. And this makes this all the more imperative that we get an additional supply of vaccines. The United States has them. There's not a need for them at this point in time there, but there is a need for them here in Manitoba and across Canada. So this is, I think, a common sense solution to address that problem.
Premier, can you speak in more detail about those shipping delays and how that's going to affect the projections? Or is it still estimated that most Manitobans will be able to book their appointments by the end of July?
You know, Maggie, I just learned about the delays as you did yesterday, and so I can't give you detail or projections. I think the vaccine team should be able to do that, but I know they've always considered the keeping of appointments as a top priority, not having to cancel, and have done a pretty good job of making sure that Manitobans haven't been forced, as unfortunately has happened in many other provinces, you know, to make an appointment, hope that it was coming, and then have it canceled. So I know that they'll be able to probably answer your question better than I can right now.
From Global News, Anya.
Good morning. Mr. Premier, you said earlier this week you discussed vaccine incentives. I'm just wondering if you have any update on those incentives.
We'll have more to say early next week, Anya, and I think that's really important. We've seen in other jurisdictions that it reaches a point where lineups for people waiting to get vaccines goes very quickly to needing to persuade people to get them. And we know that we can't get where we need to go unless we get more people vaccinated, as I spoke about last week. So I'll have more to say on that next week.
Thank you. And do you have any reaction to the graduation that was held at Springs Church earlier this week?
Just learned about it as I was coming downstairs to see you, so I'll certainly look forward to finding out what's actually happened before I comment. But obviously, if there are violations, I would expect that there would be consequences for that, and it would be most unfortunate.
From the Brandon Sun, Tyler.
Thanks for taking my question, Mr. Premier. I mean, much has been written about Canada's rollout of the vaccines, but from your summation, from what you've understood to this point, what's the root of Canada's failings thus far compared to the United States' success?
Well, first of all, let me say that I'm pleased, I think all Canadians are, to see the increased number of vaccines being made available, and disappointed yesterday with the news that that number will be reduced in the coming weeks below what was anticipated. But we've, in Manitoba, and I think we're not alone in this, we've taken steps to really encourage more domestic research and subsequently, of course, manufacturing of vaccines. And we're going to continue to pursue that. This isn't going to solve the current problem, but it can help us to secure a better supply on boosters, or if there is a subsequent pandemic or variants that need to be addressed, it's better if we have, we think, the domestic supply available to us so we don't run into these shipping difficulties and orders not being kept and so on. So we'll continue to pursue options to get more security around vaccine supply here domestically.
Okay, thank you, sir. And my follow-up, I just don't quite fully understand this situation in North Dakota. Is there presently an agreement that's being held up, or is this you asking them for their vaccines that they aren't presently using? What are you currently advocating for south of the border?
I'm advocating for the United States and the White House particularly to get out of the way and let states and provinces cooperate on getting vaccines that are in freezers in the United States up into Canada into ARMS. It's called ARMS. We and North Dakota have built a very strong relationship. We had an agreement in the planning stages we were wanting to implement that would have got thousands of vaccines up here, and it was shall we say, kiboshed by the White House. So I don't want to see that continue. I think that's not the way to deal with the problem. The way to deal with it is to solve it together. And so we have the opportunity to do that, and that's why I reached out to the Prime Minister on this topic yesterday. He's supportive of getting vaccines from the United States up to Canada. We need President Biden to say stop saying no, and we need President Biden to start saying yes. Yes is the right answer.
From the Winnipeg Sun, Glenn.
Yes, Mr. Premier, Glenn Dawkins from the Winnipeg Sun. I just wanted to follow up on the previous, or not previous question, the Brandon Sun question. So you're calling on the president to lift the restrictions. I'm a little unclear on what exactly you're asking for today.
Governors and premiers are, I think, unanimous on wanting to get vaccines from the United States that are not in demand, that are being stored there, up into Canada, into arms. This is what we need to do. The obstacles that have been presented emanate from the White House, Washington, D.C. Up till now, our initiatives, and I believe there may be others underway as well, such as the one I alluded to with the New England governors and the Maritime premiers and the Quebec premier, want to see these vaccines come from the United States up into Canada and get into arms. Joe Biden has said no so far. We think the right answer is yes, and that's what we're pushing for.
My follow-up, just kind of go back to the Springs Church. The Mayor Bowman yesterday said there should be some kind of for repeat offenders an additional fine. Would you advocate that? And because this is a church that has been fined in the past for breaching the public health orders.
Yeah, well, I thank Mayor Bowman for the advice. We instituted that 2 weeks ago, so we have double fines for second offenders. That's already there, but I'm not going to comment on an issue I don't have the information on. I just tell you that we brought that penalty up because we wanted an additional deterrent, and I think the mayor and I are on exactly the same page on that.
From CBC Radio Canada, Mohammed.
Hello, Premier Pallister. Thank you for your time today. I had a question. You said that there is some shipping delays. Do you know if this is affecting second doses in Manitoba?
Again, Mohammed, I can only tell you that the vaccine team, I'm sure, will be able to give you detailed information if there will not be any delays in second doses. I only know that when we have 20% reduction in our order coming from overseas, it emphasizes the point that we need to get vaccines up here from the United States. After all, they're just a few hours away. We have trucks ready to go. We've got freezers in them. They're fueled. We've got drivers. We need to get down there. We need to get those vaccines. We need them back here. I want them to be in Manitobans' arms, not sitting in freezers in Minneapolis. Doesn't make sense to me. Common sense says, let's solve this problem. The governors, the premiers want it solved. We just need Joe Biden to say yes.
Thank you very much. And my follow-up will be on this. What were the reasons given by the White House for saying no to this agreement on vaccines?
The White House will have to give their reasons. They won't persuade me that this is that they're good reasons. Manitoba, North Dakota, our border states, our two countries have the strongest relationship of any two countries in the world, of long standing. And so I do not understand what other priority the White House might have for vaccines that would be more important than helping their leading trading partner. Their longest, closest relationship is with Canada. How they would have any reason other than to help Canada at this point in our history defies logic.
From CBC Manitoba, Marina.
Good afternoon, Premier. Manitoba is asking for federal help. It's sending its patients to other provinces and now trying to get vaccines from North Dakota. We are clearly desperate for help, and yet we're not even in a total lockdown. Why not?
Well, I think asking for help is the logical thing to do. We'd be the first, Manitoba's been the first to offer help to other parts of our country and world when we had the opportunity. We lead the world, frankly, lead the country in charitable giving, but we've helped all around the world as people. Now our hour of need is here. And I think it's only reasonable and fair that we would ask for some help. So that's why I spoke to the Prime Minister yesterday about getting additional staff available to us, about assisting us in that respect, because I think that's very important. And also, Marina, on the contact tracing. We had a previous arrangement that we used during the second wave where StatsCan employees helped us with contact tracing. And that's really important because our contact tracers are having a hard time getting through. Some of the folks that are getting contacted, getting COVID, are not being as helpful as could be the case in terms of providing information, names, things like that, perhaps because they're concerned that they broke the public health rules. So we're needing even more work to be done with our contact tracers because we have to reach out to the folks that our people who are infected have been in contact with so we can help stop the proliferation and growth of COVID, particularly the variants.
Premier, though, health workers have been calling on a lockdown since the beginning of April, concerned about the rising case count. Do you not think that we would not be needing to ask for this level of help had we been put into lockdown sooner?
We moved earlier on our restrictive rules, which were already some of the most restrictive in Canada than other provinces. As far as our stage of COVID, we began with more severe restrictions when we had 100 cases. Then we stepped up within 2 weeks and put even stronger restrictions on in terms of things like gatherings. No restrictions will work unless people abide by them. When the opposition leader went out and broke the rules with an assembly, not wearing a mask, he set a bad example to the people of Manitoba, particularly in the inner city, where the proliferation of cases is the fastest. That was a shame. What we need to do is have people abide by the public health orders. And if they do that, then the restrictions can work, and that's what our public health people are telling us their greatest concern is. People have to abide by the public health orders, and we have to get vaccinated. And that's why I'm talking about vaccines today, because I do think that that's a critical part of how we get through this third wave faster.
From the Canadian Press, Steve.
Morning, Premier. President Biden promised earlier this month to share more vaccines with other countries, including Pfizer and Moderna, on top of the AstraZeneca that's been sent so far. But by all appearances, it would seem to be sort of a country-to-country thing at that level as opposed to states and provinces. So why do you doubt that that might happen? And have you corresponded with the White House and received any reply?
On the second question, yes and no. We have corresponded. We've also corresponded with the U.S. governors to ask them to add their weight to this. As I mentioned earlier, the Atlantic Governors Association has already spoken out on this, and I would like to see others do the same. As you know, Steve, provinces have been delivering health care in this country since the Canada Health Act and before, and provinces want more vaccines, and we want them now. So this is why I'm speaking out now. The vaccines are sitting in freezers miles away. We have people here waiting, and we need those vaccines up here. So I'm asking, and I hope others will do the same, that Joe Biden stops saying no, and that he says yes to getting those vaccines up here. Yes would be the right answer. No would be the wrong answer.
And I know you've been asked about the Springs Church incident, and you said it's just come to your attention, you don't have the details. But there have been cases where there have been public rallies publicized in advance, and there's been no move to proactively shut them down. There are agents there to take video and issue tickets, mostly after the fact. But as most Manitobans follow the rules and obey public health orders, many are wondering, why is the government not being proactive in its enforcement and shutting down some of these rallies, one of which is planned for next week?
Yeah, no, I'm wondering that too, Steve. Quite frankly, I think what I'm hearing from Manitobans is incredible frustration from people who've been doing their absolute best to honor the health restrictions, doing the right thing, making sacrifices. Businesses are hurting, families are hurting, relationships are suffering. We're all doing the best we can, and we've got some people out there who choose not to do that. And that's very, very hard to take. And so that's why we stepped up with our enforcement. That's why we've stepped up with our fines and actually increased them to be, in terms of overall enforcement, the strongest in Canada. Because we believe very sincerely that if orders are followed, we can get through this third wave. But if people won't follow those health orders, they're going to be part of the problem. I'd rather that Manitobans chose to be part of the solution, most assuredly.
From CTV Winnipeg, Mike.
Hi, Mr. Premier. In an interview yesterday, Mayor Bowman essentially said that you will not speak to him. I'm wondering why that's the case when Winnipeg is the COVID-19 outbreak epicenter of the province.
We have ministers in charge of relationships with municipalities. I've got a lot of things to do during a pandemic. The mayor is free to discuss any issue he likes with me through my ministers, and that's what we've been doing. And so I can only say to the mayor, this isn't about him. This is about Manitobans.
Okay, then can I ask, when was the last time you did directly speak with the mayor, either on a phone call, Zoom call, or the like, to discuss the situation in Winnipeg?
Through my ministers, we speak to the mayor every week. We've had dozens of contacts with the mayor's office. We repeatedly communicate with the mayor on other issues besides the pandemic, and that's the way it'll continue.
From City News, Marie.
Hi, Mr. Premier. I'm just wondering if there is already an agreement in place with the New England states and the Atlantic provinces. Why is there somewhat of an issue with getting this agreement in Manitoba and North Dakota?
Just to be clear, the agreement is to call on the federal government in the United States to allow for vaccines to go from the states that are adjacent to the Atlantic and Quebec region up into Canada. We require the White House to allow that to happen. The bulk of the vaccines are distributed through the Federal Emergency Management Agency, FEMA, and the federal government there needs to give approval for those vaccines to be released and moved from the states where they are not in demand up to Canada where they are. This is common sense. The sooner this happens, the better. And so, again, here in Manitoba, we've been working hard with our relationship with North Dakota to look for solutions. North Dakota and Manitoba want to see these vaccines used in Manitoba because the sooner we can get our relationship going again, trade, social, every aspect, the better. And we just need Joe Biden to say yes. That's the right answer.
And you said you spoke to the Prime Minister, and did he say at all that he's going to talk to the President about that and make this agreement between the states and the provinces somewhat feasible?
Sure. I raised the issue with the Prime Minister of vaccine availability, and he was very, very clear that he supports the idea of getting more U.S. vaccines into Canada. And so I appreciated that support. Now we need that support to be communicated in every way possible down to the White House to get Joe Biden to say yes to this arrangement. And this will get more vaccines up here. We've got trucks ready to go. We could be going today down to the States, picking up vaccines, have them back in Winnipeg, get 100,000 more people vaccinated in the next 10 days. That's what the vaccine team tells me. They have the additional capacity to do. Just need the vaccines. Not doing any good in the freezer in the States. Could do a lot of good in the arms of Manitobans right now and right across the country. This is a good common sense idea. This is a call to arms. We need to get the vaccines from the States up into Canada now.
From CJOB, Skylar.
Hi, Premier. Thanks for your time this morning. I'm just wondering why the shots aren't doing any good in the States. Why have we reached this point where there is that much supply? Is it they're reaching a point now where there is some hesitancy in North Dakota, or there's just too much supply, unlike what you say is happening here, kind of the opposite?
Yeah, there's vaccine hesitancy. There's a lot that's been written about that, Skylar. We're not there yet in terms of our supply availability, so we've got lots of people, we're full. But I'd like to get us to the point where we had more vaccines very, very quickly. More vaccines, more people getting vaccinated. That's how we get through this third wave quicker. The bulk of the people that are hospitalized right now, according to Dr. Atwall's comments just yesterday, are people who haven't had the chance to be vaccinated or haven't chosen to be vaccinated. We need to make sure that we get as many people as possible vaccinated so we can get those numbers down, help our frontline workers, help protect our healthcare system, and that'll mean fewer people in hospital, fewer people in ICUs too eventually. But right now is the time to get those vaccines from the States up here.
Thank you for that. And I would imagine Governor Burgum has, a much more regular line of communication with the White House than, say, you or any other Canadian premiers would. Is he also reiterating your same call?
Governor Burgum and I have a great relationship. We have worked together not just on the truckers thing. As you know, we had the attempt to expand this to include teachers. We're ready to work together on an ongoing basis as we move forward to make sure that we get more vaccines available as soon as possible, because we both understand and value the incredible Red River Valley relationship that Manitoba and North Dakota have.
From CBC National News, Austin.
Good morning, Premier. We're hoping for an update on how many extra healthcare workers are coming from the Fed and a little bit more clarity on what their roles will be and when they'll be here in Manitoba.
Yeah, I'm looking for that update too, Austin. I can't give you an update right now because I haven't got one yet from Ottawa, but I do have assurances from the Prime Minister that he's ready to help. I gave him a fairly specific ask that's already been reported upon, and the sooner the better, obviously. And I want to say a thank you to the Prime Minister for reaching out. Manitoba has a long history of offering help to others. On an ongoing basis, we offer healthcare help, for example, to Northwest Ontario, but we've also sent hydro workers down to Quebec, for example, during the repair period after the ice storm. We've sent firefighters to other parts of the world. We're ready to help. Right now, we need the help, and I don't think there's anything wrong with asking when you need help. So I'll appreciate the help when we get it, and the sooner the better.
Thanks for that. We continue to see people break the rules here, as you know. I'm wondering, why does Manitoba not follow another province like Ontario, let's say, and introduce $10,000 fines for rule breakers to send a stronger deterrent for people who are clearly not getting the message?
Yeah, I've heard that proposal. I think someone said yesterday we should make the fines $10,000. You know what? It seems to me that it's not as effective to just put, a $10,000, $50,000, $100,000 fine out there as it is to do the policing. And so that's what we've done. We've added more enforcement. We've added more officers. We've added more boots on the ground to get them out there. But, no system will work if people won't work at the health orders. We need to continue to educate, and we've been doing that. But I think the frustration people feel now is, for heaven's sakes, we're 15 months into this. Can't you get it through your head that your behavior is impacting on other people? And that's the frustration, and I get it. I'm frustrated too, because the people that are going now into our hospitals, not all, let's be clear, but too many of them have broken the public health orders willingly. And so that's a big part of the problem that we need to keep addressing with deterrence and education as we move forward to get through this thing.
Our final reporter this morning, Mr. Premier, from the Verdun Empire Advance, Anne.
Good morning, Mr. Premier. It's wonderful to have a Saturday call when this important news is breaking. Of course, I wonder, what do you think our Prime Minister can do to impress Mr. Joe Biden to cooperate? What can he bring?
Well, I think he could probably ask this question, Anne. What would be more important than to assist your longest-standing, strongest ally in their time of need? And I think the answer to that question should be obvious to a thinking person. Nothing is more important than helping your longest standing, strongest ally in their time of need. We have a free trade deal. We should have free trade in vaccines. Let's get vaccines in arms. This is a call to arms. The vaccines that the states have, their domestic supply has resulted in an oversupply. Their vaccine hesitancy in many parts of the states means they have way more vaccines. In fact, we have a projection that from Duke University that by the end of July, there will be hundreds of millions of vaccines in surplus in the United States. Well, why do we not get those vaccines where they're needed right today? That's the message I'd be giving were I given an opportunity to speak to Mr. Biden. That's the message we've given him in writing. And I asked the Prime Minister to reiterate that message yesterday, and I most certainly hope he will.
Wow. So if we're fighting this disease from the sky, from the land, and from the sea, so to speak, there also seems to be another kind of hesitancy, and I'm speaking about treatment drugs. There's a hesitancy to talk about ivermectin. There's a hesitancy to try it. It seems, maybe you know something more about what our health system is doing, but there's certainly news that ivermectin, Dr. Alessandro Santon, an oncologist working with a laboratory at Yale, believes that ivermectin could be very effective. He's worked with it. He's tried it. And, of course, he's not the only one. It's apparently a drug that does no harm. In particular, it's not got a big risk to try it, but it has helped many, many people. Are we doing anything with that? And if not, why not?
We're pursuing domestic research that we hope can lead to better vaccine availability in the future, perhaps not during this wave, but when we need boosters in coming years, or if there's another pandemic, to have Canadian research available. And we have production, of course, in Manitoba. It's our leading industry is drug manufacturing. I just want to say thanks to all concerned for the rain. Our fire situation, though not fully addressed, is been significantly reduced in terms of its danger as a consequence of this rain. And of course, when farmers make money, we're all better off. And this is $1 billion rain for our ag community. So I want to thank the people in charge for making that rain available. Keep up the great work. Thanks, everybody. Have a safe, long weekend.